Hi, everyone, and welcome to our webinar. Thank you for joining us today. My name is Tiffany Brown, and I'm a business development consultant for Therap Canada. Prior to joining Therap, I worked for an agency who provided services to individuals with intellectual and developmental disabilities. I had the pleasure of being part of the agency's transition from paper to electronic documentation and got to see the agency's transformation to providing better supports through better documentation. Therap Canada has many different solutions available for electronic documentation. Today, we're going to focus on the benefits of using an electronic MAR and EHR system. If you have any questions at all throughout the presentation, please feel free to put them in our Q&A, and we will try our best to answer them before the end of the webinar today. Now I'd like to turn it over to my colleague Calvin to introduce himself and tell us a little bit more about Therap Canada.
Thanks, Tiffany. Hello, everybody. My name is Calvin Christensen, Business Development Consultant with Therap. I've been with Therap for a little over 7 years, and prior to my current role, I was an implementation and training specialist. And what that means is basically once you purchase Therap, I was the one that would meet with your organization to get the system implemented. That afforded me the ability to work with many agencies and to see how Therap could work and be a solution across many services, and gained a lot of knowledge from that role. Prior to Therap, I worked for an intellectual developmental disability provider organization where I did everything from being a DSP or a direct care staff to help running our residential group homes. I also had the pleasure of being at my organization where, my first 2 years we were all on paper, and then we made that transition to Therap. So saw the process it needed to take from that end, and also to see the benefits moving away from that paper. We'll talk more about those in a little bit. A fun fact about myself, I am fluent in sign language. So if you're ever on a Zoom call with me, or if we're ever to the point where we can all meet in person again and you don't want to talk, you want to sign, I'd love to communicate that way. I really would. All right, a little bit more about myself and Tiffany. So let's start moving on to who is Therap, kind of what is Therap, and maybe some of the benefits that we see organizations seeing when they move to Therap. So the first thing about Therap that we want you to know, as you heard from Tiffany and myself, we both come from the field. And so it's actually part of Therap's hiring policy to hire individuals from the industry. This does a couple things. It allows us, one, to be very familiar with the services that you provide, but also we really understand the settings that your staff will be in. And that can go a long ways when implementing a system. We've been there in terms of paper and trying to find it all, hunting and gathering it, feel like you're buried, and it's a never-ending cycle. We really have been in your shoes, and we really do speak your language. All right. At this point, you're probably like, okay, so what is Therap? So what Therap is, it's a web-based, secure, HIPAA-compliant system. We provide many solutions. Those solutions can be documentation, case management, your communication, your reporting, your funding tracking, some of those things that you see on your screen now. In addition to that, we all in all have about 70 modules. And so we would love to meet with your organization to talk specifically about how Therap can assist you. Some of the benefits that we see organizations receiving from moving from Therap are a couple things. The first one is Therap is very, very accessible. In some of the previous images that you saw, you're seeing many different devices, okay? So Therap can be accessed from cellular data or internet. That means if you have a laptop, a desktop, a cellular phone, a tablet, a notebook, you're going to be able to access Therap from those devices and from those connections. The great thing about that accessibility is if you are in the point of transitioning, it really does help your staff with change, because at least they can use a device that they're familiar with. We really do see that helps out. You're going to see that, we've seen over time that Therap saves agencies time, resources, and money. We all track paper, okay? You guys know there's a cost with housing it, with sharing it, ink. There's a lot of things that go into it, and time. We do find that agencies save time, money, and resources. We also will help improve your accountability, your reporting, your documentation, your communication. again, you're going, because of the accessibility, you're going to see that transparency. And so more folks are going to know what's going on and have access to that information. And you guys, again, can hold folks accountable. The last one is really what Therap is about, okay? And it's the biggest benefit that we see. Therap should really be a tool that not only helps you with your quality assurance processes, your reporting, to make sure that you meet your regs, whether that's within your organization or the province, is that this should be a tool that really helps your organization provide the highest level of quality of support that you can to the individuals you serve. And that really is what we are about at Therap.
Thank you, Calvin. At Therap, we have a lot of different subject matter experts with experience and expertise in various areas, such as health needs, person-centered thinking, data analytics, and much more. Calvin and I recently had the pleasure of sitting down with one of them and learning more about our electronic MAR and health tracking system. Fayonne Johnson is an expert in Therap's medical-related modules, and she tells us a little bit about the benefits that she's experienced in the provider world and as a Therap team member. Let's watch our conversation now. Hi, everyone. Today we're here with Fayonne Johnson, who's going to share her expertise on why using an electronic MAR and health records can benefit agencies. Fayonne, can you tell us a little bit about you and your background?
Awesome. So I've been with Therap for the last 8 years. And prior to that, my background is actually in nursing. I've been a nurse for the last 15 years. I work primarily with the health-related modules in our application. So the MAR, the pharmacy interface, a lot of the reports and business intelligence. And I also do some work with our interoperability modules, hence the title. So I do some work with our HIEs and our SFTPs too.
Awesome, awesome. So today we're talking about transitioning to an electronic health record or an EMAR over paper. Could you recommend why you would recommend utilizing a system that's electronic over paper and some of the benefits?
Accountability, first and foremost. Using an electronic medication administration record tool allows you to kind of get into the weeds and remove a lot of that human error, a lot of the potential for medication errors, and it just holds folks accountable and accounts for much, much better medication administration.
Awesome. Thank you so much.
That's wonderful. What do you feel the main benefits of using an electronic system are?
Accessibility is a really, really big one. Right now, if you have a paper MAR, if you spill some coffee on it, or if you forget it from one location to the next, or it gets misplaced in the trunk of the car during transportation, then you don't have an easily accessible MAR to reference the next time you need to give a medication to an individual. With the EMAR, you've got instant on-the-go access, whether you're using the mobile browser or whether you're using a web. And because our MAR can be accessed from essentially anything that connects to the internet, you always have the information that you need, not just the meds, but those allergy diagnoses and all of that related health information too.
So out of all the modules, and Therap has about 70, and there's a lot in the health tracking and with the EMAR, what is your favorite and why?
Hands down, the MAR. It's obviously a large part of what we do, and medication administration is a large part of maintaining, the health and well-being of an individual, but it's more than just a MAR. You can obviously record your meds, but you can put your treatments on there. You can track procedures. You can do things such as, what's the term that I'm looking for? You can track medications, you can track procedures, you can track adaptive equipment, you can track treatments. There's lots of things that you can add to the MAR and track for your individuals.
Awesome. And a follow-up to that. So if we exclude the MAR out of all the health tracking features that come along with health tracking, from appointments, blood glucose, and those things, what's your favorite, or did you find most useful when you were utilizing the system? And how advantageous was it?
I would say the health tracking report. So it's a little bit of a cheat answer, if you will, because the health tracking report is kind of an interdisciplinary thing. We're looking at everything from medications to seizures to vital signs. But what that really helped me do when I was on the agency side of things was get a big picture of what's happening with the individual. You know, are we seeing spikes in their blood pressure? Are we seeing an increase in their seizures? Is that related to any incidents or injuries or appointments that they might have had? So that health tracking report was instrumental in doing monthly reviews, quarterly reviews, and just looking at the individual's health and wellness from the big picture.
Awesome. Thank you.
That was one of my favorite features as well, Fayon. In the world of passing medications and trying to make sure that you're minimizing med errors and getting everything passed according to what that schedule is there an ability to see which medications haven't yet been administered?
Absolutely. So, one of the things that I recommend as you're rolling this out and implementing it with your staff is to incorporate in training the use of our due medications report. In my opinion, this should be used both pre and post MedPass, because if you're coming in, especially if it's to a new facility or perhaps you're working with some new individuals, that due medication report shows you quickly and easily what needs to be given and to whom and when. And then immediately after completing your MedPass, if you run that report again, slightly change the parameters to see what's overdue, you can really quickly see if you've missed anything and go back and address it within the appropriate window. So it's an amazing tool.
Nice. Very nice.
Awesome. So within some of these modules, a question I always get asked, and I know a lot of folks found beneficial. I know I certainly did. But can you talk about some of the type of notifications you can set up within health tracking and the EMAR?
Yeah, so you've got notifications both internally and externally to TheraP. So for example, you can set it up where you can get an SCOM automatically sent to the appropriate persons. For example, if there is high-level seizure activity, or if there are some new medications that are added, in addition to the nurse being able to see those via the health tracking review, you can set up notifications where they'll get an SCOM, so they'll get a specific message related to that individual and that event, or you can even set it up where they can get a text message or an external email. So if the nurse isn't on today or isn't signed into TheraP today, she's still aware that there's relevant information waiting for her.
Awesome. Again, that was one of my favorite things, because you don't have to live in the system, but you can still get notified.
You don't. You don't.
Too much going on.
Yeah. Fayon, you've talked about a lot of different reports today, the healthcare report, the due and overdue report. Are there any other key reports that really you used a lot when you were on the provider side that really benefited the agency?
So one of my favorite reports is the individuals and their medication report. I like to think of that as a catch-all report because it allows you to look at your MAR universally. You're not limited to a single program or person, and it really lets you take a big picture look at what's going on. You can see all of the slots available on your MAR, so you can see what was given, what was missed, what's overdue. You can see if you have what I like to call miscellaneous reporting. So for example, if someone refused it, why? And you can really quickly aggregate the data to see if it's affecting a particular individual or if there are any trends such as time frame or if it's unique to a specific staff person as well.
Thank you.
Fayon, I've got one last question for you. You've given us a lot of good information, on why folks should use an EMAR and a lot of the benefits of TheraP. A lot of times people, as they're making transitions or getting ready to move in a new way of doing things they've done for a while, can you talk about, and I know you have vast experience over your time at TheraP with implementation and specifically these modules. Can you talk about, how at least at your organization where you worked and in your experience, how staff adapt to the transition from either another system or from paper to the TheraP electronic health record?
Absolutely. I'll start by saying that change is hard. When the agency that I previously worked for was making that transition from paper to electronic documentation, I will be the first person to admit that I may have been a bit more resistant than they would have liked me to be, because change is hard. But the thing that happened is once I kind of got in there and I started using it, I realized that not only did it make my job easier, but using the application was enjoyable, so much so that I've been at Therap now for the last 8 years. So with that being said, using the MAR is incredibly user friendly. Once you kind of get over that hump of this is different, we get lots of positive feedback from folks about having that information easily accessible. And then especially from administrators too, that the data being at your fingertips, being able to see that no matter where you are, being able to pull that up at any time. It's been a great, great transition for folks, DSPs and admins alike.
Just to add on to that real quick, Fayon, have you seen a decrease in med errors, or how did it benefit the individuals overall by having the electronic medication record and health tracking system?
Absolutely. There is a noticeable downtrend, if you will, in medication errors. Because adding medications to the MAR does require a review and approval process, and you can have multiple folks do that if you need to. There's the opportunity, to check for errors prior to the medications going on to the MAR, to check for errors afterwards as well. And because you can see when medications are administered, you can see if there are things that are given outside of those appropriate windows. It's easy to read. Folks don't have to decipher between different types of handwriting. When the medications are discontinued, they're marked as such on the MAR, so folks aren't confused or accidentally administering something that should have ended. So absolutely, it's instrumental in decreasing medication errors for the individuals that you're providing services for.
Fayon, thank you so much for taking time out of your day today to meet with us and talk about your experiences and some of the benefits of using the electronic health record and the EMAR. I know we appreciate it. I know it won't be the last time we see you or hear more from you. So until next time, again, we appreciate it and have a good rest of your day.
Thank you. And as always, I'm happy to be here. Happy to help, guys.
We really did enjoy our time with Fayon. Hopefully that interview or some of those questions and some of the information you found there was beneficial for you and your organization. Again, I know we gleaned a lot of information as well. All right, so we're going to now kind of move over to our question and answer part of this. We had a few questions come in, and so we will answer them. I will start with the first one here, and the first one is, what is an SCOM? All right, and so I will answer that. An SCOM, it stands for Secure Communication, all right? And really what it is a secure way for your staff to communicate. It works just like as an email would, however, it's all internal. It's all within the Therap system. So you can't send anything outbound or inbound, and it allows you and your organization to communicate, whether it's about the individuals or clients that you serve or your staff, in a secure manner. There's also some accountability that's built in. You can see who's read your messages and when they did so. And so it really does work as a secure email within Therap. Again, you can't say anything outbound or inbound, but it is a great way to communicate. All right. And the next question is, with PRN administration, is there an ability to document any follow-ups? Yes. And so within our MAR module, you do have the ability to document those PRNs or any of those standing orders that they may have. And once those are documented, your staff will have the ability to come in and add as many follow-ups as they need. So if it's an hour before, hour after, or whatever your time period is, you'll be able to follow that and ensure those things are done, and you'll be able to report on the follow-up to ensure that was what's followed through. Another question here is there a mobile app? Yes. So as we spoke about earlier, we do work on all devices. A couple things there. One, you do not have to have the mobile app on a phone or a tablet to use Therap. We do work on the mobile browser. However, we do have a mobile app that is available in the iOS or Apple store, and also in the Android or Google Play. And so you can utilize our mobile app. It doesn't have the all 70 modules on it, but it has the functionality to capture that documentation on a day-to-day basis. All right, looks like we have one more question. All right, and actually this is going to lead us to where we're going. So they asked, how do we learn more? And actually Tiffany's going to run through here a little bit about how you guys can reach out to us to meet and really talk specifically about how maybe one of those 70 modules or more would be able to help and be a solution for your organization. So Tiffany.
Thanks, Calvin. We would love to talk to you more about Therap and what we can offer your agency. Please feel free to reach out to us via email. Our email addresses are on the screen here in a second. And you can also reach out to us via our website at www.therapcanada.net. Before you leave us today, I just want to summarize some of the benefits that Fayon shared with us. Transitioning from paper to an electronic MAR and health record has proven valuable, with increasing accessibility, accountability, and again, most importantly, the improved quality of support for the individuals that you provide service to. Thanks again, everyone, for coming today, and we hope you have a great rest of your day.